My name is Kimberly Stewart, and I am the radiology manager here at the Toledo Clinic. Typically, we're seeing nuclear medicine patients that are in need of finding out what is going on in not so much an anatomy issue, but as a physiology or a function issue. We see a lot of cancer patients, oncology patients, and also a lot of general surgery patients. They've had surgery, they're still having some issues, so we need to find out what's going on. So how we find the issues is one of three ways, and it's depending on the body part that we are wanting to look at. The first way that we would, it'd be simply giving an injection in the vein or hand or arm, just similar to what we would do for a blood test. So no different than having a regular routine blood work done. The second way to do them would be to simply inject the material into a substance, and you would ingest that. Like eggs, we do a study called gastric emptying, where we make radioactive eggs, and then the patient will ingest that, and then we're able to see how well that's functioning throughout, mainly looking at the stomach to see if there's a problem with the stomach. The third way that we would is to simply inhale that through a nebulizer, very similar to breathing treatments, to where we would mainly look at the lungs in that respect to see if there's anything going on with the lungs of why you're short of breath, or if you have any problems with possibly any blood clots. So those are the three main ways that we would normally do a nuclear medicine procedure for someone. There are no side effects in any nuclear medicine procedures. It is not foreign to the system. It's simply using the chemistry that's already in our bodies. So once it's introduced, the body knows what it needs to do with it. So you're not going to get the side effects like you are with some other procedures where you inject a contrast into them. So you can go from your procedure to home in no time. The benefits of the Toledo Clinic having a nuclear procedure done here or a PET-CT procedure is mainly the cost factor. We do them, we do it very efficiently, but the cost is much less than anyone else around in the area. Please give us a try. We'll treat you like family. Like I said, with the cost factor, that is a substantial amount, especially with all of the insurance issues that people have. And it would be very efficient and effective.